As the Omicron variant is spreading in all locations, Cecil is experiencing an all-time high positivity rate of 30%, which means that 3 out of 10 people being tested have COVID. This official number does not include the many recent at-home tests that people have done, so it's possible the rate is even higher. On Wednesday in Elkton, there was a steady flow of people arriving for testing.
Patrick Brown. I live here in Elkton. Actually, I had tested positive about a week and a half ago after my girlfriend had tested positive the week before that. Used a home test at that point, and I just wanted to have the PCR test, mainly just to verify everything, knowing that the home tests are good, but they're not perfect. Pretty decent line right now, so a lot of appointments going on, but everybody's getting in and out pretty quick. It also looks like they have some rapid tests being done today as well.
Hi, my name's James Cossack. I'm from Northeast Maryland. I came to get a COVID test, precautionary. And I got out of my truck, I walked in, they asked me my name, confirmed it was me. I went and got my test immediately and walked out immediately. The whole process took 3 minutes. I can't complain. I was ecstatic, in and out.
On Tuesday, Cecil County's health officer, Lauren Levy, presented a COVID update to the Cecil County Council. Ms. Levy reported that Cecil COVID numbers remain exceedingly high, and both Christiana and Union hospitals have been at 100% capacity for a number of weeks and are at a breaking point.
So I want to start by saying that we're at a critical point. Hospitals across the region are becoming rapidly overwhelmed. Less than 2 weeks ago, Maryland hospitals reached the 1,500 COVID patient threshold that triggered activation of their pandemic plans. Since then, numerous hospitals around the state have adopted crisis standards of care. Today, Governor Hogan announced that Maryland has reached a record of 3,057 COVID admissions statewide. Here in Cecil, Christiana Care Union Hospital has been at more than 100% capacity for a number of weeks. Per our report from the hospital today, there are 51 COVID positive patients admitted. The healthcare workforce is being stretched beyond the breaking point.
Ms. Levy pointed out that the demand placed on hospitals by COVID patients affects non-COVID patients as well.
So the resources that are being taken up by COVID patients are resources that cannot be deployed for the treatment of other chronic health conditions, such as heart failure and COPD, and this results in less than optimal delivery of care. The consequences of this high rate of hospitalization is reduced lack of access to care, whether people are seeking treatment for COVID or non-COVID conditions. The vast majority of COVID patients being admitted are unvaccinated. And again, I'll say it, vaccination is safe, it's effective, and it prevents severe illness and death.
Earlier this week, Governor Hogan declared a 30-day state of emergency.
And so the truth is that the next 4 to 6 weeks will be the most challenging time of the entire pandemic. Our newest projections as of today show that COVID hospitalizations could reach more than 5,000, which would be more than 250% higher than our previous peak of 1,952 last year. While we are hoping for the best, we are actively preparing for the worst.
The governor's orders included a relaxation of licensing restrictions for nurses to address the current staff shortages, the creation of 20 new testing sites, and the deployment of the Maryland National Guard to assist with testing and vaccinations. As the governor stated, hospitals, including Elkton's Union Hospital, are seeing high volumes of infected individuals. Union Hospital's intensive care unit currently has 19 COVID patients with 3 available beds, according to the U.S. Health and Human Services data. Union Hospital currently has a red alert status in the state's chat system that advises EMS units about emergency department volume. A red alert indicates that an ER has no ECG monitored beds available and that only unstabilized Priority 1 patients will be received. On the vaccination front, the available data shows that Cecil's rate for fully vaccinated people over the age of 12 has improved over the past 2 weeks from 48% to 63%. though it is still below the statewide rate of 71%. The unvaccinated, for whatever reason they may have to resist getting the shot, represent the majority of those entering hospitals with severe COVID. Governor Hogan highlighted this point in Tuesday's press conference.
As I have been repeatedly saying over and over again, the single most important thing that you can do to protect yourself, your family, and your fellow Marylanders from this virus and its variants is to get fully vaccinated and to get a booster shot. Throughout all of 2021, nearly 75% of those who tested positive for COVID-19 in Maryland were people who had not been fully vaccinated. Nearly 84% of all our COVID hospitalizations for the entire year were people who were not fully vaccinated. And more than 84% of the more than 4,700 additional Marylanders who died from COVID-19 last year were not fully vaccinated.
While many government leaders, such as Governor Hogan, who regularly urges people to get vaccinated, Cecil County government's messaging regarding vaccinations has been at best low-key. Apart from a press release on August 12th recommending vaccinations as the best way to protect yourself, Cecil's low vaccination rate has not been addressed. In multiple emails, the county executive's office was contacted to request an interview on the subject, but we received no response.